So when we're talking to our client, we want to make sure that we collaborate with them. So if we're encouraging them to quit smoking, you want to make sure that you're not telling them you must quit smoking now. No, you want a two-way communication happening where the client is talking to you and you're talking to the client. You want to make sure that you watch your tone when you're talking to your client, so do it in a very caring and compassionate manner. And remember that at the end of the day, the responsibility for quitting smoking is up to the client. That's not your responsibility. You just have to educate them. At the end, it's their choice, whether they decide to quit or not. So we can't force them, basically. We know that there's lots of benefits to quitting smoking. You could save a lot of money. There's no tobacco breath. The stains on the teeth wouldn't happen, right? There's so many benefits to quitting smoking. You'll be around to see the kids, and then of course body, right? Your body will you'll have a there's lots of benefits to stopping tobacco use. One of the things one of the benefits is money saving. You save so much money because cigarettes are very expensive. You don't have any tobacco breath. The stains on your teeth would go away. You could be there longer to see your kids grow up. And you wouldn't have as much heart trouble or gum disease or high blood pressure. All that would go away. You'd feel more in control. And that's the bottom line. So when you have clients who are not ready to quit, and you want to do a brief intervention. And what a brief intervention is you want to accept the client's decision to not quit, but then also in a very kind way provide them information on, why they should quit, but accept that they're not ready to quit. And then you want to do some motivational interviewing, which we'll talk about in a bit. So something you can do is ask open-ended questions. So you could ask the client, so what do you like about tobacco use? Or you could say, what kind of roadblocks come to mind when you think about smoking? When you think about stopping smoking, to smoke, for example. So what kind of roadblocks come to mind when you think about stopping smoking? You want to affirm change talk. So that means if they tell you something, you could say, oh, that's a good point. Any other concerns that you have? So you're affirming what they said. You agree with what they say. Then there's reflective responding. And reflective responding is you're kind of paraphrasing what they said. So you could say, so one of the most important considerations for you is how your smoking might affect your daughter. Right? That's because let's say your client said that she's worried about how smoking is affecting her daughter. You're rephrasing that. And lastly, you could summarize your whole session. So whatever you talked about, you summarize it. And you could say this by saying something like, so if I understand you so far, you enjoy smoking because it relaxes you, but you have some real concerns that this is beginning to affect your health. And you're worried that you could be a negative role model for your daughter. You're kind of rephrasing that. And then you could end by saying, I have confidence that you will be able to resolve this issue of smoking once you have made up your mind. If it's all right with you, I'd like to check in with you at your next appointment to see where you are in your thinking about all of this. Just know that if you decide to try to stop smoking, we can help you. So you summarize everything that you've talked about before you dismiss the client. And that's really important, to summarize everything. So there are many resources available for people to use to help them quit smoking. So there's a smokers helpline where there's a phone number that they could use. And what they do is they send daily texts, you could call them anytime you have a craving, you can call them. They're really, really great. Ontario also has lots of programs that are out there. So I usually have in my clinic, I usually have brochures and pamphlets about different resources, and I give them to the clients if they're interested. There's lots of support groups, there's webcam counseling, there's so much that's out there, and a lot of them are free. So anytime you want to offer tobacco cessation, you want to encourage a client to quit, there are some steps, and we're going to go over these steps. So one of the things is assessment. So you want to figure out the client's level of motivation to stop tobacco use. You want to see what the reasons are for quitting and then use that as a motivation to quit. You want to see why they quit before and why it didn't work. Why did they relapse? Why did they go back and do it? And figure out how you could change what happened then so that it doesn't happen again. We're going to look at this later on in a different slide. It's really important that you set a quit date. So 2 weeks from now, they should quit. And that means there are many ways to quit. They could either do cold turkey, they could do gradual reduction, and we'll look at that as well. Oh, actually, it's right here. So they could do cold turkey and quit completely. They could gradually slow down. They could switch brands. They could, instead of taking 10 cigarettes this week, they could, go down to 7 cigarettes, and then the week after they could do maybe 5 cigarettes, and then, right, they just slow down, use less and less cigarettes each day or each week. It's important that they understand that they need to avoid tobacco completely. So if it means avoiding going to their friend's house or socializing with other people that use tobacco, then so be it. Distract themselves. It's really important to learn how to distract yourself when you have a craving, because craving usually disappears in 10 to 20 minutes. So in that 10 to 20 minutes, figure out ways to distract. This could be exercising. This could be deep breathing exercises. This could be taking 10 slow, deep breaths, right? There's so many different ways you could distract yourself, or you could encourage the client to distract themselves. Alternatives basically mean that, think about if you're smoking all the time, you're using that back and forth hand motion, right? Your hand is going to your mouth at all times. The hand keeps going back to your mouth. So to replace the cigarette, some people will need to put food inside their mouth to, mimic that hand to mouth motion. And so you could encourage them to have healthy snacks. And some examples are sunflowers, the seeds, the sunflower seeds and shell, fruits, raw vegetables, xylitol types of candy, so sugar-free candy. People even use flavored toothpicks, right, as something to mimic that hand-to-mouth motion. And if they are able to quit, remember that we could tell them to think positively. In their brain, they should always say that you can do this, and then reward themselves. If they went through 1 day without smoking, find a reward that they could do. If they go to 1 week without smoking, they deserve another reward. 2 weeks without smoking, another reward. So reward is very important. It's also important to get support from other people. So tell family and friends that you're quitting to smoke or you're quitting smoking, and they'll be more understanding. This is a video of a friend's video, actually, of Rachel trying to encourage Chandler to quit, and her way of showing support was by offering a tape. And that tape was a hypnosis tape that would hypnotize Chandler to quit smoking. Relapse. So within 2 to 4 weeks of quitting to smoke, so let's say I quit smoking, my next 2 to 4 weeks would be the hardest because I would be going through so many withdrawal symptoms. I'd get depressed, I'd get anxious, I won't be able to concentrate, I won't be able to sleep. And at that time, that 2 to 4 weeks, that's the time where I would probably relapse. I would probably go back and smoke again. So it's important that I'm aware that in the next 2 to 4 weeks, I need to do everything in my power to prevent relapse. Another thing to keep in mind is that you might want to ask your clients about their alcohol use, because what happens if people abstain from tobacco, then they may resort to drinking, right? So you want to make sure that the clients avoid both tobacco and drinking. So remember, you always want to follow up your client. So you follow up your client on your quit date, then you follow them up 1 week after the quit date, and this could be a phone call. All you have to do is phone call and see how they're doing, and then 1 month after. And when you're calling them, make sure you congratulate them, offer lots and lots of praises on your client for their success. And if they went back to smoking, then make this a learning situation and figure out how we can help them quit again. There's lots of nicotine replacement therapy. There's lots of things they could do or they could use to help them to quit smoking. So there's the nicotine patch, which is very common. There's nicotine gum, which they could use to help prevent that craving. And then they could always go to a doctor and get a prescription for or a prescription drug to help them with their craving. And the prescription drugs are Zyban and Chantix. Remember, as hygienists, we can do more than just being in a clinical setting and encourage our client to quit. We could get out in the community and we could lobby for having tobacco-free environments, having areas in the community where tobacco is forbidden, for example. So there's lots of things you could do. You could volunteer for tobacco-related events. You could provide education to children, sport teams in a group setting. So we don't just have to be in a dental clinic. We could do a lot more. We could go out in the community and educate them about the negative effects of tobacco.